Good evening, everyone. Welcome to the Renaissance Center uh, RC Chat conversations about mental health. We thank you for joining us this evening. We pray all is well with you. May is Mental Health Awareness Month, and I know we've been doing these chats, believe it or not, for a year because we used to do, in-person events, but then the chats took off. So we're grateful to be able to do them monthly now. So tonight's chat is in honor of course, our top three issues and concerns during this season, which is COVID-19 still, that's still a thing. So for you people that think it's not, it is still a thing. Mental health, which is big, not just because of COVID, but it was a pre-pandemic concern that has just been brought to the forefront because of COVID. And then, of course, grief. We have unprecedented losses worldwide and even in our own country and community. So it's hit every home of many of the persons that we either talk with or share with. We know of persons that have been impacted by grief and loss in this season, whether it's COVID related or, from some other ailment, or we know the violence that's in our communities as well. So that's why we're here. We're here to support you with what you may need. So the Renaissance Center is offering up to free 2 sessions for persons that are in the Baltimore County and Baltimore City area. And you can call to get more information about that at 410-409-0025 or check out our website. And we'll have a graphic with that information up later on in the program. But we want to get straight to our topic. And tonight, our session for Mental Health Awareness Month is being co-hosted or co-produced, we'll say, by our Social Actions Ministry of Morning Star Baptist Church. And so Sister Latranya Ware is going to give us some background information into what the Social Action Ministry does. And she really helped us coordinate tonight's event. And we thank God for her efforts and her passion. So Latranya.
Thank you so much. Hello, Lady Carla, distinguished guests, and everyone tuning in virtually. My name is Latranya, and I am a member of the Morning Star Baptist Church Social Actions Ministry. Morning Star Baptist Church, under the leadership and direction of Bishop Dwayne C. Debnam, is committed to transforming lives and empowering our communities. In line with the church's vision, the Social Actions team of committed volunteers are focused on equipping the community to impact social injustices through education, supportive services, and alliances. Our ministry has been quite busy and active throughout 2020 and 2021, despite the pandemic. In fact, I would like to share some of our accomplishments with all of you. So our team has worked diligently in engaging the community in areas of voter registration, educating the community on COVID safety, vaccine, and vaccinations. We completed a community survey to determine where our team should focus its resources. And from that, we were able to send letters to elected officials voicing the community's concerns. In 2021, our plans include launching a small and minority business initiative to highlight Morningstar business owners and promote our slogan, eat local, buy local, and invest local. We will continue our COVID-19 vaccine information education efforts. We recently launched the Book of the Quarter Club to bring awareness to social justice issues. We are planning a police reform segment. And such as Lady Carla said, we have recently collaborated with the Renaissance Center to create tonight's discussion with all of you to bring awareness to and address negative impacts that COVID has had on people's mental health and well-being. So with all of that great information, if anyone has a passion for helping make an impact on social injustice, please consider joining our Social Actions Ministry team. You can email socialactions@msbcministries.org. Again, that's socialactions@msbcministries.org. Thank you so much, Lady Carla. Thank you, everyone.
Thank you, LaTronya, for that great information. We encourage everyone who's interested in social actions, and it's more than just doing participating in protests, which we have done that. Also handing out masks. So we're doing a lot of various activities in that arena, and one of them, of course, is making sure we get the word out about COVID, mental health, and grief and loss, which are impacting our communities as well. So I'd like to introduce our distinguished guests. And so we will have them introduce themselves, which is what I always do. That way you get to say about yourself what you want to share. But we are covered in every of the areas that we're discussing tonight. And so we thank God for our esteemed guests. So Dr. Dunn, I'll start with you, then Ms. Langston, and then Dr. Dury.
Good evening, everyone. I'm excited to be here. My name is Ifeoma Dunn. I'm a psych nurse practitioner. I graduated from University of Michigan Flint with my doctorate in nursing practice. I've been working as a registered nurse, psychiatric registered nurse. I've worked with University of Maryland. I've worked with Northwest Hospital, Life Bridge. I've worked with the State of Maryland, Spring Grove Hospital. I've worked with the State of Correction Institution, Maryland State of Correction Institution in Jessup, all focusing on mental health. So all I've been doing is mental health since I entered into the nursing career. And as a provider right now, I'm also working with Talkers Baltimore, servicing the people of Baltimore, focusing on their mental health and substance abuse. So pretty much is a passion for me. Mental health is my passion. I believe in evidence-based care and patient-centered care. Thank you, Ms. Carla.
Thank you.
Okay, hello everyone. My name is Jennifer Langston. I'm a licensed clinical professional counselor. I have been practicing for about 8 years. I have worked all along Baltimore and in Frederick and Gaithersburg in outpatient mental health programs. I also work in with co-occurring disorders. So at a methadone clinic in Baltimore, and also part-time for the Renaissance Center.
Dr. Dury, look, I was muted, sorry.
Yeah, I'm still muted. Can everybody hear me? Fantastic. My name is Michael Dury. I am a physician. I've been a physician for now, I know you don't believe this, Lady Carla, 27 years. I have practiced in a number of arenas. Presently, I'm practicing as a general practitioner in internal medicine, as well as in addiction. I help to run 2 addiction centers in the city and state. And I also have 2 primary care practices that I'm a part of. My addiction medicine is probably 30% of what I do every day versus my primary care. I'm a Chicagoan. I'm a 16-year member of Morning Star Baptist Church, married, happily, children, happily, blessed.
That's great. So as you all can see, we have a great variety on our panel this evening. So let's get right to the questions. We know that in this season of, COVID-19, we have had, several 100,000 persons die of COVID. And then, of course, we know it's other illnesses, like I mentioned earlier. What are you all seeing in just in the community as far as people's handling of grief at this time? Is it, I know we couldn't do some of our customary things, but are you seeing even more challenges for grieving during this season?
I guess I could go first, since I probably spend the greatest period of time in direct patient care. One of the issues has been that we have seen a number of different age groups affected by the deaths themselves. So I guess I've adopted a kind of saying that I use every day, that it's okay not to be okay, because there is a lot of anxiety and depression surrounding people being stuck at home, not being able to work. There's a lot of marital stress. There's a lot of stress from loss of friends and family. And so I kind of see it on all levels. And all we can really do is offer them encouragement, to be extremely honest. We do our best in my practice to stay away from medicating, and we are pushing patients toward counseling.
Oh, that's great. What about you, Ms. Langston? What are you seeing in the community with grief and loss?
Definitely an impact from isolation, since a lot of my clients depend on community support to help get them through, especially these big life transitions and life factors. So the isolation has definitely impacted them. As Dr. Michael said, with children or in families and teenagers, being on school, having to adjust to being on the computer all day for school, that's a big adjustment, especially in their last year. So if you were a junior last year, you're a senior this year, and you're still in the same position. And that is also causing a lot of stress as well. And also the social interactions that they get from being in the classroom or being around their peers, they're not getting that.
Yeah, that does seem to be a struggle for students. Some of the children that love to be on video games, it's no big deal for them, but the rest of the persons that like to interact with their friends and like to be at the bus stop and talk, they're missing out. Dr. Dunn, are you seeing an increase with the grief and sorry, I muted myself, with addictions? How are more people relapsing in this season?
Yes. So like I said, in my practice, I'm seeing a lot of grieving. And I would just want to start off by also saying, like, if I stand to be corrected, but there has never been a thing like this before. Like worldwide, we're talking about over 3 million people that has died. And when we bring it home in Baltimore City, we're even talking about over 1,000 people. So that's a lot of death. And what I've seen in my clients, even if it's not directly their loved one, but somehow, somebody that has passed. Mm-hmm. So when we're talking about grieving, it's a normal process, right? We are all human. We're going to feel our loved ones or somebody we know, not directly to us, but it still affects us in some way. So I've seen it. The biggest one I'm seeing, a lot of my clients, some of them, they kind of blaming themselves for the death. I've seen that a lot. So it's hard for you to grieve when you're taking blame for the death of your loved ones. So I've seen them talk about, oh, it should have affected me. I'm a young person, but it hit my grandma. Now my grandma couldn't, survive it. But like Dr. Michael said, we're not pushing towards medication. So in something like that, we focus on therapy, CBT, trying to change their thought process and how they view things. I've sat with a client and, just talking to them, encouraging them, like Dr. Michael said, is the way forward, not medication. And this is something I see every day. And with grief comes with anxiety, comes with depression, comes with suicidal thoughts. But I've always told my client also that there is help out there, online resources, grief support group. Some of these groups online that are able to send text messages like to you every day, encouraging you, and also to remind you like, it's not your fault, this is a pandemic. So definitely, yeah.
Yeah, I think that is so on point because people are blaming themselves in some ways that, we could have prevented some of these things. But we know that for the most part, people are doing the best they can to adhere to the, social distancing and any kind of COVID rules. It's just that because again, it's something that's in the atmosphere and you can't see it to avoid it. Doing the best you can is all you can do, but also making sure the support systems that you do have available to you, that you take advantage of it, like the online support groups or the text messages with encouragement, maybe even out, a lot of churches have prayer calls every morning. So if that's your thing, that might not be your church, but it could be someone else's. But these are things that are getting people through the grief and the loss that is Dr. Dunn said, is worldwide. This isn't just something that's happened at home. It is worldwide. And so make sure, just take care of yourself. That's what you can do in this season. Now, Jennifer, Ms. Langston had said something earlier about the isolation. And so, what I know things are opening up, so let me go there. But because we've been in isolation for over a year now, some people are apprehensive and still feel like isolation is what's best for them. So are you all seeing any of that in the community where people are afraid to come out more than they were before? And I'll start with you, Dr. Dory.
Clearly, there's still a fear, an apprehension about coming out. I deal with a lot of assisted living patients and nursing home patients who were so isolated that we actually had to write letters for them to allow their family in to see them. Normally they interact at breakfast or, during the day with some activity, and they were literally isolated to their own apartments or rooms. We even had an uptick in suicide in the elderly population due to isolation. So it's been a very big deal. But slowly but surely, I guess they're becoming more confident, at least about coming to the doctor. As far as doing any other activities, they're, or going to the store, maybe they'll do that. But beyond that, they don't want to be involved.
Okay, what are you seeing, Ms. Langston? Are you seeing that too with your persons you serve in the community?
So I see a combination of both. Because I work with co-occurring disorders, I provide mental health at a methadone clinic. So it's different because that is, for a lot of clients, their sense of community. A lot of them are kind of excited to be back, and at the same time difficult because for a lot of clients, again, this has never happened before. Stimulus payments have impacted that, so they're getting more money than they are used to getting, which decreases their desire to engage in treatment. So there's those. Then there are those that are like, okay, well, I like the community support. I like the idea of having groups, and we can socially distance there. And then some are, again, like Dr. Michael said, apprehensive about reintegrating into society as far as attending doctor appointments, as far as coming to see me. They prefer the telehealth as well. So it's interesting.
Yeah, I would agree. I know I talk to a lot of persons and they're apprehensive about returning to work because they're just so used to being home now. And then they were also apprehensive about when school reopened recently, about sending their children. And I think this week it started with 4 days a week, um, that the schools would be open. So I know a lot of persons have opted out of what they could opt out of. So if they had to do something, they were willing to go out there and do that. But Dr. Dunn, what are you seeing in your practice with persons and their way they're adjusting to the isolation and re-entering back into the community?
Yeah, I think slowly but surely, with my patient, they're coming along, but we still have a long way to go. Like I said earlier on, this is something that has never happened before. So, but I believe we are on our way to healing. So it's a lot of healing. You've been socially isolated for almost a year, more than a year right now, and just getting back to the usual activities is not something that is going to happen overnight. So like Ms. Jennifer said, I'm seeing a little bit of both, but as healthcare professionals, what we should be doing in order to get back to norm is re-educating these clients, giving them the right information, reassuring them about the precautions to take to avoid the spread of COVID-19. And also in our place of work, if you happen also to be in a leadership position, I think also accommodation also will go a long way. What I mean accommodation, the example that came to my mind, like for the healthcare professionals, like the pregnant women, the vulnerable, although there's no kind of any research that kind of says you affect pregnant women more, but if you're pregnant, you're going to be worried about your baby. So some places of work, they've kind of accommodated to pregnant women in the sense that they're not going to care directly with the COVID-19 patient to limit their exposure. Also, if you have underlying chronic conditions, Dr. Michael can say more to this, a little bit more accommodation, maybe like number of people you see a day and maintaining social distancing. But above all, it's kind of reassuring. We have supplies right now, cleaning supplies, face masks and all that. But like I said, it's going to take a while, but re-education overall is going to be the key to getting back to norm.
Yeah, I agree with the re-education and reassuring people as well. And like you said, we have the supplies. It's just a matter of getting our mind back to that. Dr. Dory, what are your suggestions for people, especially from a health perspective, and they're apprehensive of going back out because of, fear of the environment? Do you have any suggestions to your patients?
So I'm a safety first guy. No matter what the statistics show, I encourage everyone to wear a mask. I have not honestly seen any evidence that wearing more than one mask is more protective. I still tell them to social distance. If they're out in the street and they don't have to social distance, then they can take advantage of that. But otherwise, I'm still kind of pro safety at this point. I did want to add, I left this out from the previous topic. We have been seeing a lot of polysubstance abuse, more so than prior to the pandemic, to the point where a lot of our folks who we had gotten down to maybe one form of opiate or one form of treatment have re-added alcohol and cocaine and whatever anyone can get their hands on secondary to despair. So I just didn't want to leave that out because that has been really big and it has affected the actual death rate in the city of Baltimore. But beyond that, my encouragement is still safety first.
Yeah, safety first. We can't emphasize that enough. And, you know, when we think of safety, we think of physical safety, but of course, there's some mental health tips that you can take. And we know we've heard it's okay not to be okay, and that's true. But it's also okay to reach out and get that support you need. That's, of course, why we're here tonight, because we want you to know it's okay to reach out. It's okay to not be okay, but it's not okay not to reach out and get the help you need. And one of the concerns, and I hadn't even thought about this, that Dr. Dory just mentioned, is the polysubstance abuse. We know that over the past year, that alcohol drinking, you know, has gone up. So people have been drinking more. You know, Wine Down Wednesday went to the whole week, Wine Down Week. You know, everybody was drinking wine, you know, all day, every day, adding, you know, I mean, I know this, you know, from people that we talked to, and I kind of said, how about some tea? You know, how about some water instead of wine? So there are things you can do that when you see yourself increasing in negative behaviors that you hadn't done prior to the pandemic, you can check yourself or tell a friend, hey, I noticed I've been, you know, drinking more wine, or I've been doing this, I've been doing that, and get an accountability partner. That's really key. But what other suggestions, Jennifer and Dr. Dunn, do you have for persons who have picked up some negative coping strategies? They think it's a coping strategy. How can we help them turn those things into something healthier? So Jennifer and then Dr. Dunn.
I think education is big. And it's all in the way you present it to someone. It's hard for people to hear you when you have a problem. That sounds very blaming. And to the other person, they can automatically become defensive. But just educating them on some things you may have heard, or bringing awareness to their behavior. I noticed this, and what are your thoughts? And asking for feedback, but just kind of the education piece. Oh, and what they can do to change their behavior. Sorry, Lady Carla. And some things they can do is developing a new schedule of things to do. So those hobbies that you may have put off in your spare time or due to the pandemic, find ways that you can kind of revamp those things at home. So, okay, you may not be able to go to the gym, but you can walk outside. Or you may have missed fall cleaning, maybe you could do spring cleaning. Or you may like to take pictures, you can create an online scrapbook. There are different things to do, kind of being creative in your approaches.
Okay, so like Dr. Michael said, there is increase in polysubstance abuse. That's the truth of the whole thing. And like Lady Carla asked, one thing I want to say is there should be no delay. So if you notice a friend has picked up a habit that he or she wasn't doing before, like drinking more wine, there should be absolutely no delay. If that's a friend, that's a family member, you want to tell them to contact a professional. We are all professionals here. Talkhouse Baltimore is open 24 hours a day. We have the crisis stabilization unit. You just need to walk in there, no criteria. You don't need insurance. You don't need anything, because when we catch them young, when they are just picking up the habit, it's easier to have a good prognosis. Whereas they have been drinking for a long time, damage to their liver and so many things. So I just want to say, let's seek the right help. Even when we're seeking help, it's okay, talk to a family member, but please make sure you're reaching a professional. In Baltimore area, we have a lot of substance abuse clinic, crisis stabilization unit, and so many people that you can reach out to and get treatment that you need, get detox from alcohol, get detox from opioid.
Okay.
Get our treatment, and I believe that's what we should be doing.
Can I
Okay,
add
great.
just a couple
Yeah,
of
you
things,
can add.
if that's okay? One of the things we try and remind folks is what they like. So, one question I ask is, what do you like to eat? Did you play sports in high school? Is there something you and your father used to do together, or you and your mom used to do together? I guess I call it a blessing now. I was blessed to go through some counseling at one point, and one of the questions that the doctor asked me was, when is the last time, may sound funny to you guys, but when was the last time I just went and bought a pair of underwear, right? And for a man, we don't really, I don't know, maybe what you guys' experience is, but the doctor was just trying to remind me that I have to do things for myself to make me feel good. It could be a bubble bath or lighting a candle or listening to your favorite music, but it's reminding people what they like to do and then making sure that they do the things that make them happy outside of wherever they are in substance abuse.
That's good. I mean, because people do need to know that they do have some internal resources that they haven't thought about, that they may have, overlooked just because it seems too simple. Like, is that all I need is just to get back into playing tennis or hitting balls, walking, cycling. But it is tapping into those interests and those things that are already there. Now, we do have a question in the chat, more specifically, and we talked a little bit about this, but how do we suggest people get back to the idea that they will have to return to work? Now, for us on this, we've been in work. I mean, I've gone back to the office. Nobody else has come to see me in the office. Everybody's doing Zoom, but, and I know you all have been in the office in some places. So how do you suggest other persons get back to school, the office? Those are the only two, and church. People don't want to go to school, work, or church. This is just from my small sample. I don't know about the people you all talk to. So how, Jennifer, Dr. Dunn, and then Dr. Dury, what are your thoughts about how people can practically go back into these spaces?
I think if your job allows, and if you're not on a strict timeline, maybe you could practice setting the timeline for your reintegration back into work. But if you do have a timeline and expected date to return, slowly start reintegrating things that were part of your work routine for practice now. So if you knew every morning you had to get up at a certain time, try setting your alarm clock and just getting up instead of rolling out of bed. I'm speaking from experience, rolling out of bed and rolling over to your laptop. But try setting an alarm, getting up, getting dressed, and then getting on your laptop. I think practice makes close to perfect. So the more you practice, the better it will feel. Although the desire may not be there, I think if you practice, it'll get your body and your mind back in the habit of reintegrating.
Dr. Dunn? Yeah.
Okay, so I'll add to that. Like for me, it's passion for me. So when you remember your passion, I'm speaking from my experience and as a healthcare provider. So it's a passion for me to serve my patients. And I pretty much know that even if I can do telehealth from home, I know physically being there is really what will serve them better. So I remind myself that I'm doing this to save someone out there, to make someone's outcome better out there. So for the people listening to me, I don't depend on where you work, but sometimes we put ourselves first, but sometimes also we have to consider people that we serve. So think about it that way. I've been out of work for, more than a year. It's time to go back. It's time to go do what I love doing, especially if you love what you're doing. I think that should be the drive also. And like I mentioned earlier on, reassurance, there are cleaning supplies. Dr. Michael mentioned it. Make sure you're wearing your mask, you're testing, maybe every week, every other week. That's also reassuring that your test is coming back negative, and hopefully things goes well. But like I said, the biggest drive should be your passion and the people you serve, and trying to get back to normal and trying to defeat that fear and moving forward.
Dr. Dury, do you have any suggestions? And just a follow on to that, does it matter the age of the person, or do these suggestions help for any age group?
I think the fears are universal.
Mhm.
One of the things I kind of do is I preempt by saying, in a couple of months, we're going to have to get back together here in the office and try to get a yes out of them, saying something like that. Or we never closed. My practice never closed. So throughout the pandemic, there were certain patients we had to see. If they were at a point where we had major fear, we would send them to the ER, but they didn't want to go to the ER because they thought if they went to the ER, they were going to die. So we had a lot of patients who we would normally speak to every 3 months that we were talking to 2 and 3 times a week via telehealth, just to get them through the initial part of the pandemic. What we're doing now is just giving people information. Even with exact information, we still can't get beyond all the borders that people have set up, boundaries that people have set up, because they don't quite want to believe even the statistics that you're giving them that are supportive of them being able to get out of the house, get back to work. So I think it's a ramping up that we do, that we start to get them thinking about what it would be like to go back to doing what we were doing and the way we were doing it before, and let them know, I've been here the whole time. I've taken the precautions. I've taken the vaccine, and giving them education about it, giving them the statistics, and hopefully the information will give them some kind of confidence about stepping out there.
Dr. Dury, I do want to add to what you said, because that's very important, with letting our clients know that they also can't set boundaries within their workplace if they don't feel comfortable doing something. So again, setting boundary, I'm not comfortable with that, or I won't be shaking hands when you come into my office, or may I have my office cleaned ever so often, so that they can also feel comfortable and know that they have choices in the matter.
I think that's a good segue into how the different age groups can get through this season and get reacclimated, is that they have choices, they have options, and that is safety first. So it is that psychoeducation, or just that the safety education of safety first. And if parents get on board with the return to back to school, then the children will feel confident about returning to school. We know some colleges had school the whole time. Some K through 12 were open, a lot of the past year. So not fully, but incrementally they stepped up to a full opening. But so those are some of the things that we can do now, because if we know that in September, right, that everybody's going to be going back to their office in September, if not June, because we know some jurisdictions have lifted all occupancy. So that, but there again, you can ease into it if your job is flexible and will allow you to ease back into the workforce. And so I would suggest that as a non medicinal treatment for anxiety and depression, what are your thoughts about this? Is from our chat. What are either of your thoughts about meditation? So we'll start with Dr. Dunn, then Jennifer, and then Dr. Dory.
Yeah, so meditation is very effective to help in treating anxiety, depression. So when you meditate, you kind of trying to replace negative thoughts with positive thoughts. So when you think about positive things, that kind of calms your nerves and helps to improve your mood. So yes, meditation works. So those are the things we are really telling our clients, like Dr. Michael said, and I support it. And, it's not something we want to go into medication for, especially we know the stressor, right? We know it's pandemic. So let's treat when you remove the stressor, then anxiety definitely is going to reduce. And when you're meditating, it means you're focusing more on other things rather than focusing on the stressor, like taking your eyes off the news 24 hours a day, trying to listen to what they're saying. So when you're meditating, you're focusing on yourself, and that can help improve your mood and decrease anxiety. So it's a yes for me. Meditation do works.
Yes, I agree with Dr. Dunn. And I also don't want people to feel limited with thinking they have to do a traditional meditation. Finding the meditation that works for you, whether it be going on a walk and just being mindful of being present in that moment, whether it be looking at a candle, just focusing the concentration, anything other than the future or what you have to do or what you didn't do, but just helping you stay present in the moment. Also, coloring is another meditation that one could do, or just free writing. Yeah. So don't feel limited in your types of meditation.
Well, I am an unplugger. So, in particular, when I get home, I literally cut off the phone, and I literally cut off the television, and I can sit in the dark and just do nothing. And that tends to really, help me personally by really unplugging, not halfway unplugging, but really just letting whatever stressor of the day has affected my being go, at least for a short period of time. So for me, it's now that unplugging may turn into meditation or just relaxation. But I'm a big fan of unplugging. Beyond the meditation, there are some patients who have invested in things like acupuncture, which is very relaxing. There is aquatic therapy that some patients do, where you go into a warm pool, you don't have to swim, water never gets above your chest, you set your watch and you just walk around until you feel tired, take a break for 5 to 10 minutes, walk around another 5 minutes. It's just a form of exercise as well as therapy.
Yeah, those are all very helpful, because we know that persons are looking for alternative treatments for their depression, anxiety, and other things they may be going through. And so these are some great suggestions. And, you know, find what fits you, again, for your personality, you know, for just your interests. Some of these things you already are aware of. You just have to be reminded that these were things that you enjoyed, you liked, things that were meaningful to you, whatever those things are. And I know we all saying we're zoomed out, but you know, we have had been able to stay connected again via Zoom. If persons have questions, don't forget this is your chance to ask. We're talking about mental health, COVID, and grief. So just, you know, put in the chat what your questions may be. We're here to answer those questions. One of the questions that people are still on people's minds, we know that there is a vaccine hesitancy out there. And today we heard that younger people can now get vaccinated. I think it was 12 to 15-year-olds, so as young as 12 now can receive the vaccine. And we know that some adults and children, I mean, adults of all ages have some apprehension. So it's not just, you know, a certain demographic, but those are the persons who would influence the children. So what are your thoughts, each of you, on not necessarily the vaccine, but how people can maybe overcome their apprehension about it, and how they could, what are good trusted sources of information? I always tell people, start with your primary care physician. So I'm a big pusher of people into get a physical, make sure you talk to your primary care. But other than those options, do you all have any suggestions for people who are still on the fence?
So one of the major problems we run into is misinformation and disinformation. So one of the questions that I start out with, and I mean, it may sound a little harsh, is how many people have died? And, you know, we estimate somewhere around 580,000 people at least have died of COVID or COVID-related causes. And then I asked them how many people have died from the vaccine. And so a lot of folks then ask me, well, how many people have received the vaccine? So I tell them it's about 103 million, which is about close to a third of the population of the United States. And then it goes into the, well, I heard. So the I heard is the misinformation, and so said is more disinformation. In other words, we begin to talk about the Tuskegee experiment, and is there a different vaccine for Blacks? Is there a different vaccine for whites? You know, can we trust the research? This all was created so quick. How do we know that the time was taken for the vaccine to actually truly be effective? So, you know, we kind of go through a spectrum of questions. Most of it is question and answer. I do not try to convince anyone to take the vaccine. I do not try to convince them. I give them the information. I answer their questions. If they ask me if I had it, I'm honest with them. And that's as far as I go with it.
Yeah, that's how I do as well. And I'll send them to the CDC website, right, or other health.
NIH.
Yep, NIH, you know, Cleveland Clinic, you know, trusted sources, and then they can read up on it for themselves. How about you, Jennifer and Dr. Dunn?
I agree. Giving them the information for that, because the 9 times out of 10, the person that has their mind made up about the vaccine is not either is going to take it or not going to take it. But those truly curious will actually do the research because they are asking to know. So yes, I agree with Dr. Dury in not forcing anybody to take the vaccine, but more so giving them the resources to find out the information for themselves.
Yeah, I agree with Dr. Michael. The only thing I want to add, I know we've mentioned like the various websites that it can go, the CDC, NIH, FDA, WHO. But I just want to say one thing, please, if you're listening to me out there, stay away from personal blogs. That's not a place to get the right information. And, you know, we as healthcare professionals, we're not going to persuade you, or but we want you to make up your mind based on the right information that you get. So please, blogs, personal blogs, they are a no, 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 no.
Yeah, I'm glad you mentioned that, Dr. Dunn, because apparently somebody out, it's probably more than one person, but they're on TikTok, with their take on the vaccine from what they say is a biblical stance. And so I would, like to share with those persons that are Christians or have some faith and spirituality, that you have to consider the sources of information, even from spiritual leaders or so-called spiritual leaders. So I'm just going to put that out there. As a spiritual leader, I can say it. So as a spiritual leader, I can say it's okay to check out the source of their information that they're sharing. Like we're saying that when we give you information from a medical standpoint, we're sending you what? Back to medical locations that are verified, that are, strict, have strict policies and procedures. So we're sending you back to that from a medical and clinical standpoint. But sometimes when you're dealing with matters of faith, we are sometimes taught not to question the sources of this information. So I'm encouraging you not to necessarily go toe to toe with people, but to do the research for yourself, even as far as that goes. But again, no bloggers for medical or spiritual information, because remember, I could quit my job today and start a blog tomorrow and say whatever. So not that all bloggers are giving misinformation, but we just want you to do your research. Research. And if you don't know or understand something, ask, and carry a dictionary. It's okay to look up words you don't know. All of these things really matter, because this is serious, people's mental health, our physical health, addictions, the poly addictions, as we heard today, are increasing. So we want to just, stay away from people's opinions. We have a couple of more questions. How do people get the information that they need if they don't have access to the internet? And then again, what can we do to help our grieving family and friends? So if people don't have the internet, where should they go? I say their primary care physician. If they don't have a primary care physician, then it's probably out, you all can give me some more ideas besides that. So
public library, like the counties, they have libraries and they are open. Even with the pandemic, they're open to the public just to use the computer and look up stuff, but not for like reading or anything like that. So definitely the public library is a place to go. Login is free. You just have to register, and then they assign you a computer and you can look up the information that you need. And about the grief is more about reaching out. I don't encourage anybody grieving to stay lonely. reach out, even if you can visit your family in person, but you can have a time together with Zoom video call. And also people have been doing funeral service over the Zoom because that also helps with closure. And even if you have a dying person, like with the COVID complications, and they already said the prognosis is bad, is poor, you can set up something like Zoom to see them and all that. So it might not be like in-person visit, but definitely can substitute, and that can help with closure.
That's good. Dr. Dury, we know during this season, a lot of people haven't been able to sleep. It's a lot of insomnia. And so do you have, and I'll ask everybody this, any tips that people can use to help them sleep? And one of the questions in the chat was, what is your take on melatonin? So I'm going to ask you, Dr. Dury, about melatonin, and then tips from everybody. So
Okay, so there is no true definition of adequate sleep versus rest. For some of us, that may be 5 hours a night, some it may be 6, some it may be 8. There's a misnomer concerning rest in that that it is regular, and that if you don't get a certain amount, then it's unhealthy. So I'll say it this way: there are a lot of sleep aids out there that you can use, but it is normal to sleep 4 hours some nights, and 6 hours some nights, and 8 hours some nights. There's no true sleep pattern that most folks who work maintain. Melatonin rarely, if ever, will cause a problem with you. It might not work. I guess I'll give it to you the same way I give it to my patients who even ask about health supplements, vitamin supplements, non-traditional aids. Most of the time they won't hurt you, they may help. So I'm certainly not against you trying them. Do I prescribe melatonin? Yes, in doses as high as 5 milligrams. For some patients, I use Benadryl because it usually doesn't have a hangover effect. But I wouldn't want you to hear that and then just go do it. You need to be instructed on how to use it, how often to use it. Your whole medical picture in particular needs to be looked at before you choose any kind of supplement for your body. So again, there is no true sleep pattern. Sleep is different than rest. Most of our supplements will not hurt you. They may not help you, but you need to be guided.
that's good. And I see we're almost out of time. So this will be our last question, and then we'll close out about the sleep. So any other sleep tips?
I would encourage those, if you could, to create some kind of nighttime routine, whether that is you're going to cut the TV off at a certain time, you're going to take a shower at a certain time, just things you can do to kind of engage your body in the feeling of relaxation and prepare your body for sleep. So nothing in that is going to stimulate you, but things that are going to calm you, drinking sleepy time tea, engaging in a meditation or a prayer, or things that are going to relax you and help clear your thoughts too. Because a lot of people, a lot of sleep sometimes is interrupted by either stress or anxiety, or just worry about things that are usually out of their control. So anything you can engage in, again, grounding techniques to kind of bring you back to that present awareness and engage your body for the task at hand, which is sleep, the better you may feel. And it may be helpful for sleep.
Yeah, I just want to add caffeine, please. No caffeine 4 hours before bed. Things that contain caffeine, coffee, sodas, and things like that, and can help promote your sleep. And also, like I said earlier on, with the COVID-19 creating anxiety, so we're seeing insomnia a lot. Anxiety can lead to insomnia, so do not watch those news close to bedtime. Like Jennifer said, cut off your TV, unwind for the day, and try to do the better you can do things naturally, the best, rather than seeking trying to get medication. And if you do need medication, please, like Dr. Michael said, get the advice, guidance of a professional provider.
Yes, that's good. Those are some great tips, and these are things that are on people's minds: how to get through the grief, how to get back to work, to school, how to sleep at night, and what to do about the rise in addictions as it relates to COVID, because people were using those things to cope. So hopefully tonight, everyone, we just still, as again, scratch the surface of these topics. But again, we want you to know that we understand what you're going through. The Renaissance Center is here for you. We have at least 2 free sessions. And you can call us at 410-409 is right there, 0025. And this is our 20th year. So we're going to close out with a premiere of our new Renaissance Center logo. Hopefully Lisa's still there and she can show it. So I have it on my screen, but I think she has it too. So, but thanks everyone. Thanks Dr. Dunn, Dr. Dury, and Ms. Langston. This is our new, our new logo. So you all will be seeing this in the next few months. It'll be on our website, on all our social media, but we're excited. The Renaissance Center is here. Sometimes all it takes is knowing someone cares. We care, and we're here for you. So thanks again for being with us this evening, and continue to be on the lookout for our 20th anniversary celebration opportunities, which will begin in July. So we will make sure you know what that's all about. And we can't wait to see you. Maybe you can ease back into life at the Renaissance Center activities, So you got 2 months to prepare your mind to be with other like-minded people. So thanks again. Have a good evening, everyone.
Bye.